Good afternoon, everyone. Very much welcome to our SEEtalk. And as you know, this is the last session, official session during SEEDIG 6. But I find it very symbolic to look at it not as a concluding intervention, but rather as a forward-looking discussion. Because the topic we will be discussing today can be very much considered as an introduction into something which is brand new, not only for SEEDIG community, but for the whole internet governance ecosystem. And we will be talking today about post-COVID-19 digital transformation in healthcare. And I'm very excited to welcome today our special guest, Arunakiry Natarajan, who is project manager and a digital health data specialist at Management for Health. It is a German company which was founded back in 2012 as a partnership of health sector professionals. Apart from that, Arunakiry holds a master's in medical informatics from Technische Hochschule Deggendorf in Germany, and one more master's in dentistry, as well as certifications in the field of data science. Following a career in academics and in clinical dentistry, he moved into healthcare data science. I also want to mention that we had a very short but very interesting opportunity to cooperate with Arunakiry before during the SEEDIG intersessional project on COVID-19 tracking apps in C++. So welcome Arunakiry, we are very happy to have you today with us. And we still haven't started, but I already have a feeling that I could keep asking you questions for hours. So without any further delay, let's go on. And in one of your recent articles, I found a very interesting statement saying that I'm here, it is now or never, says digital transformation to healthcare. And I liked it so much, and I want to ask you, do you believe that now is the very right moment for the digital transformation in healthcare? And if it was not for COVID-19, would this right moment also be now?
Thank you, Olga, for the opportunity, and thank to SEEDIG for inviting me for this short chit chat. So it was a great pleasure to collaborate with the SEEDIG community on working with the previous COVID tracking apps. It was an interesting and a worthwhile learning experience for me. Okay, so jumping into the discussion now, obviously. So I personally feel there are two eras now, obviously. One is like the pre-COVID era and the current era where we are in the COVID situation, and the post-COVID era, obviously. In the pre-COVID era, when you see health systems, there are two key areas of care for every individual. Like when you go to a hospital, there are two key areas. One is like elective visits, where the patients choose what they want to treat. Let's say like they go in for checkups, they go in for routine examinations and other stuff. The other part in the hospital care system is for emergency cares, where like patient is taken suddenly into the emergency and the system takes in the patient and starts the treatment at the point of the entry. Okay, so now in this COVID situation, we have one more arm that has come into the healthcare system, which is like treating COVID patients, which is very critical and very important. So now what happens is like already the existing system across different countries is overloaded. Almost there are like data telling that about 50% of the healthcare providers are being stressed and burned out, obviously. So they have lots of work on their agenda and they're not able to like keep up with the pace of incoming patients. Now, what has happened now is like it has added some more burden to the existing sort of workload for these physicians. They now have, apart from their routine day-to-day activity, they have a huge bulk of activity added on to their existing workload in the form of COVID patients, which have in fact become a priority for treatment now. So when the hospital prioritizes a treatment plan, so it puts all the COVID patients on top and says, okay, so this is our priority, we treat them first. Now, as I said, like now this is there is an increasing demand for the effort from the side of the healthcare professional. That is one point. The other point is the system as a whole. Imagine the hospital as a whole is now being overburdened. So there has to be like more resources have to be managed, resources have to be allocated properly. So this is a point, right, exactly where digitalization steps in to make the process smooth, both for the patient and for the healthcare provider, obviously. So my article was like, it came out of the blue, saying like it is now or never, obviously, because as you see, it is now. Digitalization has to happen now, because digitalization in healthcare has been like a really slow stepping progress, because there are like inherent difficulties within the system. So to input digitalization in every part of the workflow has been like very, very difficult, and it's been very, very slow. But this is the right stage where like the system has itself to understand like, okay, I need technology to help me solve the problems, obviously. So let me imbibe technology so that I solve problems easily without any without any overload for the providers, and also increase the care quality for the patients. So this is the right moment, obviously. Okay, let's say COVID did not come into the world, obviously. What would have happened to digitalization, obviously? Yes, we would have gone to this progress. We would have moved to digitalization, but not now. So it would have been, in my opinion, I would say like it would be in the next 5-6 years, we would be in the current stage, obviously. So this onset, mankind is so hard, like it fights out of troubles, obviously. Now the COVID has put up a new trouble for us, and we know how to fight it out. So we input technology, and we will win COVID, obviously.
Very interesting. And, building on what you just mentioned, and also I was comparing to our yesterday's session when we were discussing that culture is very much resistant to any digital transformation. So I'm wondering, what do you think about the healthcare sector? How much is the digital transformation in this sector different from any other industry?
Yes, you would have seen that digitalization has happened very fast in technological sectors, in automobile engineering, in fintech, let's say manufacturing sectors, where technology was able to go into the workflow very fast, because their workflow is kind of a straightforward workflow. There are no like very flexible hard parts inside of, so its workflow can be digitalized very fast. But compare to healthcare, obviously healthcare, I would say technology is still in like the very nascent stage. It's very naive, obviously, because healthcare by itself is a very, very complex topic. Obviously there are lots of players involved in a system of providing healthcare to a patient. Obviously there are lots of processes, and we call a healthcare system as a very complex adaptive system. So which means it is very complex, but still it adapts to the ongoing changes that happen in the existing system. Let's say, take for example the present situation of COVID, obviously. Okay, so in the month of in the month of January or February, COVID symptoms were like, okay, you have fever, you have sore throat, you have body pain, you have malaise or weakness. Okay, go and test yourself, obviously. Now, as the disease evolved, we came out with new findings. So we added the old findings with existing new findings, like loss of taste, loss of smell were also added. Okay, you have these additional symptoms. Okay, guys, go and test, obviously. Now imagine the data systems that are created in the month of January and February. They have to be completely shuffled, and we have to add few more content to that, so that the doctors on the other end need to collect some more information. So healthcare is obviously evolving. It evolves every day, obviously. That is one point. So that is the complexity of the system. The other point is like how an individual reacts to a disease or a treatment plan. It varies across the globe, it varies across individuals, obviously, it varies across communities. So for a particular treatment, one community can respond in a different way, whereas the other community responds in a different way. So we see in COVID as well, right, how communities respond to the infection, obviously. So like some communities, we see death rate is slightly higher, healing rate is slightly higher. So it's a very complex process. Healthcare by itself is a highly complex process. And the adding on to the complexity, if you take a healthcare system, there are multiple interconnected moving parts, we call this. These are actually moving parts, but they are quite interconnected, obviously. If you see a workflow, a patient comes on the reception, gets herself registered, obviously. So there you need a system. Then he needs to go to a particular doctor, you need a system. These systems have to talk. Then the patient goes to a test. Let's say he goes for an X-ray. You have a system there. Now all the three systems have to talk. Now the patient pays his bill. So you have four systems that need to talk together for a single patient, obviously. So this is a highly complex system. So it takes a lot of time to integrate technology into the system, but we are going it. This COVID has accelerated the whole process, and we are going towards, I'll say, like complete digitalization of the process. So which would like speed up the whole thing, increase care quality, and also reduce physician stress.
Well, that's very interesting and to some extent very inspiring, but as I see, there are a lot of complexities which you have described. But I think it would be very interesting if you could maybe give us a few examples of of how digital technology is used in healthcare, so that we have a very clear understanding of what is it. And also for us to understand who is in the center of this transformation process. Is it more about us as at some point potential patients of the medical institutions? Are these medical institutions themselves? Or maybe these are the manufacturers of the medical equipment. So please.
Okay. So technology in healthcare is at every level. So as I mentioned earlier, let's start with the scheduling. A scheduler, a calendar, a simple calendar is also a technology that can be used into the healthcare system, obviously. Okay. Just so this is the most basic version, like you input appointments for the patient, and the most advanced version would be like AI systems which can detect let's say faults in CT scans. CT scans, as you all know, has like hundreds of images, and it takes like a lot of time for the radiologist to go through all the image, because as a radiologist I know the pain of it, obviously, like, so it's like a huge sheet of images and there are slices, and you go through every slice to say, okay, this is a slice that is interesting for me. You pick out the slice and you read the slice, what is the abnormality. So it takes a lot of time and a lot of like cognitive effort from the radiologist. It's in every other field, obviously. Okay, so now you start with a basic application like a scheduling system to a highly advanced AI system which can automatically pick out an image and say, okay, this is the interesting part of the image, and just this is what is the abnormality from the normal, obviously. So we have like multiple levels of system. To quote a few examples, obviously, like, okay, so telemedicine, is one of the very good well-known, I would say, well-known system which is now used across the globe, obviously. Telemedicine is a system wherein like it's more like a video conferencing solution. The doctor sits on the other end, the patient sits in his home, don't have to travel to the doctor. For simple consultations, he just calls the doctor over the video conferencing secure line, I'll call it, and just tells like, I have this problem, doctor, what should I do? Obviously the doctor says, okay, here is a prescription, simple prescription, try this at home. If you don't recover, come back to the office, then we'll do higher investigation. So it solves a lot of problem both for the doctor and for the patient. The patient doesn't have to travel to the doctor. He or she sits at home, gets the treatment done in a few moments, obviously. The other thing is like mapping systems, which came very recently in the technology field, obviously, mapping system. But mapping systems were commonly used for construction purposes, construction monitoring, building pipelines, building roads, so all those stuffs, obviously. Now you would have seen in the COVID times, in these times, obviously, whenever you want to see what is the data of COVID now in the world, you always see a map popping up. So even the common person now sees, okay, map can be integrated with the healthcare system. It shows us like, so which country is most affected, so where are the zones of infection. So we see everything on a map. Now mapping is also coming into healthcare system. So previously, like we thought like mapping is only for a different sector of the whole domain. Now you see mapping is also integrating. The other system that are completely revamping now is the data capture systems. So previously it was like Excel sheets. You just start entering data on Excel sheets and you come and you submit to the server, obviously. Now you have very simple applications that can be used to collect data. Very simple, user-friendly, no training is required. Anyone can use it, obviously. So it's just a walk. I say it's a very casual walk-in system. So we have like multiple systems that are coming inside. These are very few interesting examples which everyone can visualize in their day-to-day life. Okay, and coming to the next part of the question, obviously, is like who is the center point? Obviously, patient is the center point of all the systems, obviously. So he is our key person who are going to treat it. It can be like any technology or non-technological process. The basic concept or basic ideology behind healthcare system now is the patient or the client is in the center of focus. So all the other players revolve around him, because we do everything just to give increased care quality for our patient, obviously. Other this is also once again a close-knit interaction. There are multiple interactions happening here. let's say, for example, like, so it will be the hospital systems that will form one circle of ring around the patient, obviously, all the hospital departments. Then you have the local legislations, then you have the national legislations, and you have the international norms. So this is one saying, start from the patient in the center, and you have like interconnected systems which try to inculcate technology so that patient care is improved.
Yes, so this is also interesting to know that we are always in internet governance field advocating for human-centric approach when applying digital technologies. So it's also good to know that the same approach is advocated for in the healthcare industry. And this brings me to my next question. Who should be the stakeholder behind and actually, who should be the stakeholder advocating most for the digital transformation in healthcare? Should this be the governments who are imposing, let's say, this on medical institutions, or maybe the medical institutions themselves are already willing and to some extent have some readiness to step on this path of transformation?
Yeah. So in my opinion, obviously digital transformation also has two parts. Like, one is a top-down approach and the other is a bottom-up approach, obviously. The top-down approach starts from the government, obviously. So the government has to like make uniform consensus and understand, okay, so we need to digitalize certain components of the healthcare system, and legislations have to start working on that, creating norms, what are the data security rules, like how do we integrate different applications together? Do we create a central data repository in a country so that data is shared uniformly across all the providers? This is the top-down approach, and this comes down from the government to the hospitals in parallel with the academic institutions, and then to the healthcare providers, individual doctors or physicians, right? The other approach simultaneously happening to that would be the bottom-up approach, obviously. So we should start from the patient's side, obviously. So patients should also be willing to say, I would say, like, digest this technological advances that is happening, obviously, because it's ultimately for the patient we are doing it. And if we do everything from the top down approach and the patient doesn't accept, okay, I don't want, let's say, telemedicine, for example, and if the patient doesn't say like, no, I don't feel comfortable talking on a teleconference system with a doctor, all the legislations go out for vain, obviously, right? So the patient also has to have, we also have to include the patient into the development, and this comes from the bottom up approach, obviously. So we educate the patients on the benefits of technology. So we train them on like how to use the technology, obviously, because like imagine WhatsApp 5 years before, no one was not able to use WhatsApp, and now it's like it's everywhere. It's user friendly. People call like even like 70 years old patient can say like, I can use WhatsApp, that's fine, I'm comfortable with that, obviously. So systems are also now evolving so that we also include all these inputs from the users, end users, making them simpler and simpler so that like anyone can use it, obviously. So the bottom up approach would be like patients start using it, they start asking to doctors like, doctor, is there is an application, can I use it, can you prescribe it for me, obviously. Then this goes up to the other scale, like, so doctors are also trained when they are on studies with digital applications, how to prescribe them, what are the payment options for prescribing digital applications. So it's both a combined operation from the government side, from the legal side, from the system side, and from the patient side, which you go. So at one point we will meet, and that is the success of getting digitalized.
And again, this is something we like so much in internet governance community, this bottom-up approach. And so that's a lot of similarities we can find. And you also touched upon a very interesting and important point of data collection. And of course, I would like to keep all the questions for myself today, but I see also a question in the chat, which is exactly about data collection. And do you know any good examples of data collection during this COVID-19 pandemic? Because we know that many countries have been struggling to apply properly data protection safeguards. So do you know of any good examples which could be used as the best practices?
Yeah, we have multiple examples, right? Okay, so Singapore started using the first COVID tracker application, obviously. So which set I would say which set a model for the entire world to follow, obviously. So this is a data tracking system, so wherein they were able to track who in which community at which geolocation is infected. which are not infected, I'll say like tested positive with COVID, obviously, and who are the persons who have been in contact with this individual, obviously. So this is an excellent example of a data capture system and data tracking system. So where this individual goes, so we get an ecosystem here, obviously. So you track the individual, you track his movements, you track individuals who have been in contact with this particular first individual, and you create an ecosystem, and you are able to now isolate and find out, okay, so I have my networks here, so I can start focusing on treating these communities and these regions in the country. So Singapore set a nice example with this the COVID tracking application. So now we have multiple COVID tracking applications developed by individual countries for their own country use. So the other systems apart from COVID, forgetting from COVID, so moving apart from COVID, obviously, so we have multiple data collection systems which offer like extreme usability in terms of if they're connected to the internet. This is one part of I would say one hub of data collection systems, which work with extreme good, a lot of good features, a lot of usable options, but connected to the internet. There is the other option, so which can be used even in low resources settings, obviously. So wherein we don't have internet, we don't have proper connectivity. So we have applications which we can still, digital applications, which we can still collect data, temporarily store it. And whenever you go to a connected area, you push the data for use, obviously. So there are multiple systems. It's a great ecosystem that is evolving here, obviously. Because as you know, data forms the backbone of the whole digital transformation process. So this is the first milestone, and it is super good here.
So it's all about data.
Yeah.
And we have one more question from our participants, and it is about how patients can access their medical records, mostly in the EU countries. Do they still need to go to the hospitals, or there is in some countries the opportunity to do that through some electronic systems?
Yeah, it varies from countries to country, obviously, how a patient can access an electronic health record, obviously. So because electronic health record is a very sensitive data content stuff, obviously, right? Okay, some patients, they'll be free enough to share this to their physicians, their friends, their relatives, obviously, say I have this, obviously. There is one sector of patients who might not be like too interested in sharing this. Okay, this is my personal data, so I don't want others to know my conditions, what I'm suffering from, obviously. So this has to be taken by case, country by country, obviously. And so we have to also involve the patients who want to like share this data. So because data sharing starts at the point of data entry, not like towards the end of the data. So you complete the whole process and say, like, can I share this data? So that is not the process, obviously. You start from the first, obviously. Okay, so we have an option that we can share your data for research, for like cross-sectoral improvements, obviously, for care quality improvement, so let's say for developing some products. So are you willing to participate? That should be the first part. So if the patient has consented and the regional registrations allow sharing, then it's good that patients are willing to share their data for studies, development, and research. Because I once again say data is everything in digital, obviously. You get data, you develop more.
And I believe it was in Singapore as well last year, probably, that there was a huge leak of medical data of the patients. So we should be always aware of the possibilities of such leaks, of any cyber attacks. When we are sharing our data, we should be somehow ready for such kind of situations as well. And thinking about looking a bit forward, I'm wondering how much are investors willing to put their money into the digital transformation in healthcare? And maybe you know any good examples of such investments, especially maybe in our region as well.
So it was in the month of February or March, if I'm not very sure about the month. Obviously, we had a report on a digital investment portfolio, obviously. So as you know, like stock markets are going down because of COVID. So it's an overall worldwide phenomenon, obviously. So we have fluctuations in stock market, obviously. But there was a continuously noted point that some of the telemedicine companies were having like peaks in their stock market, obviously. Some had new investments, some about like 58, 60% increase in their stock market shares. So So telemedicine obviously is one of the technological digitalization concepts. So obviously investors are now ready to share, ready to put more money into digital healthcare systems, obviously, because they know it is the moment where they can reap benefits. So it is the moment when money can come into the system and they can have a nice system, nice working system integrated with all the points of contact, and they can make a lot of profit off it. So this is a system. On the other hand, we also see a change in customer behavior. People are now willing to use digital systems. People are now willing to share their data a bit. People are now willing to use, say, virtual consultations. So it's the right moment for investors also to push in investment into digital health at this point of time. And coming to the region, obviously, so it's quite interesting. Obviously, I found a lot of articles on like what is happening in the region. Obviously, it's very, very interesting. I saw a few companies who have been like startups, and who have been purchased by bigger bigger giants in the US, obviously. So it's very interesting, all the activities that is going on in the region, obviously, but I'm not very sure about any particular specificities. I see a lot of things happening in blockchain, cryptocurrency, and in robotics in healthcare, obviously. So this is very interesting part. I feel a lot of potential in that side. And the IT, sorry, and the IT, and IT workforce is also extremely good in your side, obviously. So I have a lot of friends who work from your region, and so super good.
So what I wanted to say is that no crisis is never too bad, because if for somebody it is some kind of loss, then for somebody it is for sure some benefits and opportunities, and probably we should start learning how to get opportunities from any crisis that we face, because situation is changing so much nowadays that we should be very much flexible. And unfortunately, we are slowly moving, or maybe even fastly moving to the end of our talk. And I think this would probably be my last question to you. And I want you to comment on that we have been largely using this term new normal during the COVID-19 pandemic. So how do you think, what has changed and became new normal in the patient's treatment during COVID-19, and whether this would continue to be our normal for the years to come?
I see I will not say a gradual shift. I see a sudden shift in the treatment plans, which is happening in the COVID domain, obviously, right? Okay. So it's like how we transited from Web 1.0, Web 2.0, and currently where we are on Web 3.0. Web 1.0 was basically used for like browsing, getting information, sending emails. That's it. Web 3.0, what we have is more personalized information. Okay, so we have AI systems integrated on the back end, which understand like what we search for, what our interest, what is our, what do we wish for, obviously. So it gives us personalized set of instructions, personalized set of search options, obviously. So we feel like, okay, so the computer knows what I know, what I want, obviously. So it's like a one-to-one close interaction now. A similar system is happening in the healthcare as well, obviously, because previously, like let's say about 10 years back, it was more of like general treatments that were like on top. Specialty practices was slightly about like say 30 to 40%, because 60% was dominated by general practice. Now there's a total shift, obviously. Patients want to go to the specialist, obviously, because they know specialists are slightly a better option for providing specific treatment for a specific disorder, obviously. So that is one change that is happening, because practices or healthcare practices are more towards specialty practices now rather than like general practices, obviously. And the other thing is like payment plans are also differing. Like, okay, so payment plans like was previously based on time spent with the patient. Now it's most like procedures. Okay, so every payment is now linked to a procedure, because so we know from the data, so we know, okay, what procedure takes what amount of time on a normal scale, obviously. And now payment plans are always linked not to the time spent by the physician or the healthcare provider, but always linked to the procedure what the patient undergoes. So we have a system of DRG, so which calculates everything and says, okay, so you did this procedure, you can claim this amount of money. So the financial planning systems is also changing. The other thing I see is use of lot of self-monitoring devices from the patient side, obviously. Not for everything we go to a doctor now, obviously. We know how to self-monitor certain things. One big self-monitor is Google. We Google everything, obviously. So Google is like a big doctor. Obviously, I would not advise. So you also have to go to a physician. So what we do is like we use of a lot of wearables, a lot of sensors, and a lot of self-monitoring devices. Obviously, let's say temperature monitor, your heart rate monitors we use. So we understand what our system is functioning, and the patients now the big shift is like the patients decide now what they want. Obviously, so they are able to go and demand for their treatment. Like, okay, I know I have this condition, so these are the treatment options. Can you give us the best option? So this is a big shift now.
So this sounds like to take into account and to do action points for all of us. Thank you very much. I enjoyed a lot our discussion today, and I hope this is the same for our participants. And I hope that we will have another opportunities at SEEDIG to cooperate with you, and stay healthy, and see you soon at other occasions.
Thanks, Olga. Thanks a lot. Thanks for all the participants as well for participating in the event. Have a nice day. Bye-bye. Ciao.
Bye-bye. Thank you, everyone.
Hi all, and on a wrap-up note, many thanks Olga and Arunakiry, just to invite everyone for the wrap-up tonight at 7 p.m. Central European Time. We do the usual conclusions of the SEEDIG week, and then have some fun for the music night. So please do join us from 7 p.m. and enjoy the rest of the day. Many thanks, everyone.